Welcome to Medicine Handy Point. The topic is rheumatoid arthritis. The objective of today's video is to discuss first European League Against Rheumatism and American College of Rheumatology's score for diagnosis, X-ray finding of hand in rheumatoid patient. Then we will discuss the extra-articular manifestation of rheumatoid arthritis. Then we will discuss the poor prognostic factors in rheumatoid arthritis. And in the last, we will discuss the DOS 28 score, which is used for the severity of the disease. So let's start. Now, in 2010, American College of Rheumatology and European League Against Rheumatism devised a criteria for RA diagnosis. As you can say, it has joint involvement criteria, serology, acute phase reactant, and duration of the symptoms. Each one has some points given to them, and if six or more than 6 points are met, then it is a likely a diagnosis of uh, rheumatoid arthritis. Then we can take a help of history and x-rays as well, which will then give us definite diagnosis, but you have just simply to memorize this table and then apply on the patient frequently, and then you will get in a turn to diagnose the patient with rheumatoid arthritis. So it has four components. Just memorize this table. Now let's discuss the X-ray finding. Uh, there are early X-ray finding which are peri-articular osteopenia, as can be seen in the metacarpophalangeal joint, and there will be loss of joint space and there will be soft tissue swelling. But most specific finding of early rheumatoid arthritis X-ray is the peri-articular osteopenia. So look for that. Late finding are the joints will be destroyed. As you can see in the X-ray, there will be peri-articular erosions. There will be subluxation of the joints, as you can see in the X-rays. Now, extra-articular manifestation of rheumatoid arthritis. Cardiac manifestation, ischemic heart disease can be caused by it. Constrictive pericarditis can be caused by it. And ischemic heart disease is most common cause of death in these patients. Pulmonary involvement includes pleurisy. Pleural effusion can be caused by it as well. There will be pulmonary fibrosis in lower lobes can be caused by pulmonary nodules can be caused, and Kaplan syndrome, which is large fibrotic nodules in patients with pneumoconiosis and rheumatoid arthritis. That is called a Kaplan syndrome. Ocular manifestation or keratoconjunctivitis sicca, most common manifestation. There can be episcleritis and scleritis. Episcleritis is painless and scleritis is painful, redness. The neurological manifestation are carpal tunnel syndrome. Um, there are rare manifestations which include Felty syndrome, which is splenomegaly, rheumatoid arthritis, and neutropenia. Amyloidosis can be caused by it, and autoimmune hemolytic anemia can be also caused by it. Now, poor prognosis. So there are factors. First is the blood test. So these are positive RA factor and anti-CCP and HLA-D4. These are blood tests which carry poor prognosis. Then insidious onset of disease, female, poor functional status at presentation. So this you can detect from the biodata and examination and history. Then extra-optical manifestation we discussed earlier carries poor prognosis, and X-ray showing early erosion. Erosion are usually late finding, but if there are early erosion, it carries poor prognosis. Now, what is DAS 28 score? It is used for the severity. It has four components. Number one, painful joints and swollen joints. Then ESR and global health affected by arthritis. You ask the patient how much arthritis affected their life. You put them in an online calculator of DAS 28 and you get the score. If the score is less than 2.6 means the disease is in remission. If the score is more than 2.6 it means mild disease. If the score is more than 3.2 means moderate disease. If the score is more than 5.1 it means severe disease. Thank you and please subscribe.